Listen, if you're over 60 and dealing with that shooting pain down your leg that makes you want to scream, you're not alone. Snorts. Nearly 40% of people will experience sciatica at some point in their lives, and that number jumps even higher after 60. But here's what most doctors won't tell you. Those expensive treatments and endless physical therapy sessions might be completely unnecessary. A groundbreaking study published in the Journal of Orthopedic and Sports Physical Therapy followed over 200 sciatica patients for 12 months and discovered something absolutely shocking. The patients who performed just 3 specific exercises showed a 72% reduction in pain within 8 weeks, while those who did traditional mixed exercise programs only improved by 38%. That's almost double the relief from doing less work, not more. The researchers were stunned because it went against everything they thought they knew about treating sciatica. And the real kicker, the number one exercise on this list, increased nerve mobility by 67% in just 4 weeks, according to imaging studies. Nobody saw that coming. And when you understand why it works, you'll wonder why your doctor never mentioned it. Before we begin, let us know in the comments now your age and where you're watching us from. We read all comments, so drop your comments below. Now, let us start with exercise number 3 and work our way up to the most important one. Number 3, the exercise is number 3, figure 4, performis stretch. Let's start with number 3, which targets something most people have never heard of, but is absolutely critical for sciatica relief. Your performis muscle is a small but mighty muscle deep in your buttock that runs right over, or sometimes right through, your sciatic nerve. When this muscle gets tight or inflamed, it literally squeezes your sciatic nerve like a vice grip, sending that horrible shooting pain down your entire leg. After 60, this muscle tends to tighten up even more because we sit more, move less, and lose flexibility naturally with age. The figure 4 stretch specifically targets this troublemaker and gives your sciatic nerve the breathing room it desperately needs. Here's why this exercise ranks at number 3, but still deserves serious respect. A clinical trial from the American Journal of Physical Medicine tracked 146 patients with piriformis syndrome, which is when this muscle causes sciatica symptoms. After snorts, performing the figure 4 stretch twice daily for 6 weeks, 81% of participants reported significant pain reduction, and 64% returned to their normal daily activities without limitations. Snorts. Those are remarkable numbers for such a simple movement. The beauty of this stretch is that it's gentle enough for anyone to do, even if you haven't exercised in years. To perform the figure 4 stretch correctly, start by lying on your back on a comfortable but firm surface like a yoga mat or carpeted floor. Bend both knees and keep your feet flat on the ground about hip-width apart. Now take your right ankle and cross it over your left knee so your right knee points out to the side. Your legs should look like the number 4, which is exactly where this exercise gets its name. Reach, snorts, both hands around the back of your left thigh and gently pull that left leg toward your chest. You'll immediately feel a deep stretch in your right buttock and hip area. This is your performis muscle lengthening and releasing its grip on your sciatic nerve. Hold this position for 30 seconds while breathing deeply and naturally. Snorts. Don't hold your breath because that creates tension throughout your body and defeats the purpose. After 30 seconds, slowly lower your leg back down, uncross your ankle, and repeat on the other side, even if only one side hurts. Sciatica often affects both sides eventually, and prevention is always smarter than treatment. Complete 3 sets of 30-second holds on each side and do this routine twice daily, once in the morning and once before bed. Morning sessions help loosen everything up for the day ahead, while evening sessions release accumulated tension from daily activities. The maximum benefit comes from consistency and proper form rather than pushing too hard. Many people make the mistake of yanking their leg toward their chest, trying to feel a bigger stretch. This triggers a protective reflex in your muscles that makes them tighten up instead of relax, completely sabotaging your efforts. Instead, pull gently until you feel a moderate stretch that's slightly uncomfortable but not painful. Think of it as a 5 or 6 out of 10 on the discomfort scale. Hold that position and breathe. And you'll often notice the stretch naturally deepens as your muscle relaxes. That's your nervous system learning to trust the movement and let go. Another critical detail that most people miss is the position of your floating knee. That knee pointing out to the side needs to stay relaxed and open. If it starts creeping inward, you're not getting the full performance stretch. Some people find it helpful to use their elbow to gently press that knee outward while holding the stretch. Snorts. If you're too tight to reach around your thigh comfortably, use a towel or yoga strap looped around your thigh and hold both ends. This gives you the leverage you need without straining your arms or shoulders. You should start noticing results within 1 to 2 weeks of consistent practice. The pain won't disappear overnight, but you'll notice it's easier to stand up from sitting. You can walk a bit farther without that stabbing sensation, and you might actually sleep through the night without waking up from nerve pain. These small victories add up quickly. Research shows that stretching the performer's muscle reduces mechanical pressure on the sciatic nerve by approximately 35% after just 2 weeks of daily stretching. Snorts. Give your body time to respond and heal. Now, let's move to the exercise that takes your sciatica relief to an entirely different level. Number exercises number 2, the sciatic nerve glide. This second exercise might look strange when you first see it, but it's based on solid neuroscience that changes how we understand nerve pain. Your snorts, sciatic nerve, isn't a stationary rope sitting in one place. It's actually designed to glide and slide through your tissues as you move, travelling from your lower back all the way down to your toes. After 60, adhesions and scar tissue can develop around the nerve from years of inflammation, old injuries, or simply normal wear and tear. These adhesions act like sticky spots that prevent the nerve from moving smoothly. When you try to move and the nerve can't glide properly, it gets irritated and sends out those horrible pain signals. The nerve glide exercise specifically mobilizes the sciatic nerve and breaks up these adhesions without causing further irritation. A fascinating study from the Journal of Manual and Manipulative Therapy examined 89 patients with chronic sciatica who performed nerve gliding exercises for 8 weeks. The results were extraordinary. 73% experienced significant pain reduction, 68% improved their range of motion, and most importantly, follow-up imaging showed actual improvement in nerve mobility. The nerve was physically moving better through the tissues. This wasn't just pain management, it was actual healing. Here's how to perform the sciatic nerve glide safely and effectively. Sit near the edge of a sturdy chair with your back straight and both feet flat on the floor. Start with the leg that hurts, though you'll eventually do both sides. Slowly, straighten your affected leg out in front of you, while simultaneously pointing your toes up toward the ceiling and tilting your head down toward your chest. This creates tension along the entire length of the sciatic nerve. Hold this position for just 2 seconds. Now reverse the movement by bending your knee to bring your foot back down, pointing your toes down toward the floor, and lifting your head up to look straight ahead. This releases the tension on the nerve. The key to nerve gliding is the smooth, controlled rhythm. This isn't a stretch where you hold for 30 seconds. It's a gentle back and forth movement that you repeat 10 times per leg. The motion should feel like a mild pulling sensation along the back of your leg, but it should never cause sharp pain. If you feel sharp or shooting pain, you're moving too far into the range or moving too quickly. Back off slightly and move more gently. The therapeutic effect comes from the repeated gentle mobilization, not from aggressive stretching. Think of it like dental floss for your nerve. You're not trying to force anything. You're just gently working the nerve back and forth to clean up the adhesions and restore normal gliding function. Perform this exercise 3 times daily, completing 10 repetitions per leg each session. Many people find morning especially helpful because nerves tend to be stiffest after a night of not moving. A midday session helps if you've been sitting at a desk or in a car for extended periods. An evening session prevents overnight stiffness. The real magic happens when you combine proper technique with gradual progression. Start with a smaller range of motion for the first week. Maybe you only straighten your leg halfway and only tilt your head slightly. That's perfectly fine. As your nerve becomes more mobile and less irritated over the following weeks, you can gradually increase your range. Eventually, you'll be able to fully straighten your leg and achieve maximum toe pointing and head tilting. Snorts. This progressive approach allows your nervous system to adapt without triggering protective pain responses. Research published in Physical Therapy Journal found that nerve gliding exercises reduced nerve hypersensitivity by 49% after 6 weeks. Hypers, snorts. Sensitivity is when your nerve overreacts to normal movements and sends exaggerated pain signals. By snorts, regularly gliding the nerve, you're essentially retraining it to respond normally instead of freaking out at every little movement. Patients in that study also reported 56% improvement in functional activities like walking, climbing stairs, and getting in and out of cars. These are the real-world improvements that actually matter. One crucial mistake to avoid is combining nerve glides with other stretches in the same session. Your nervous system needs time to process the nerve mobilization without being confused by other inputs. Do your nerve glides as their own separate session, or if you must combine exercises, do the nerve glides first when your nervous system is fresh and receptive. Another common error is doing too many repetitions. Thinking more is better. Nerves are different from muscles. They respond best to frequent short sessions rather than long intense sessions. Stick to 10 repetitions 3 times daily and resist the urge to overdo it. Within 3 to 4 weeks of consistent nerve gliding, most people notice they can move more freely without triggering pain. You might find yourself automatically reaching for something without that familiar hesitation because your body knows it won't hurt. That's your nervous system learning trust again. Snorts. But as impressive as nerve gliding is, the number one exercise delivers results that seem almost too good to be true. Number 1, exercises number 1, the Mackenzie extension. Here's the exercise that shocked the entire medical community and changed how we treat sciatica forever. The Mackenzie extension, named after physical therapist Robin Mackenzie, who discovered it somewhat by accident in the 1960s, works on a completely different principle than traditional sciatica treatments. For decades, doctors told people with back and leg pain to bend forward, rest in bed, and avoid extension movements at all costs. Snorts. Mackenzie accidentally left a patient lying face down on a treatment table that was slightly inclined upward. When he returned 20 minutes later, expecting the patient to be worse, the patient reported the best relief he'd experienced in months. This observation led to revolutionary research that turned conventional wisdom upside down. Here's the science that makes this exercise rank number 1 by a landslide. The Mackenzie extension works by creating a centralization effect on your pain. Most sciatica happens because a disc in your lower back is bulging or herniated and pressing on the nerve root where it exits your spine. When you perform controlled backward bending movements, the disc material actually gets pushed away from the nerve root back toward the center of the disc. A landmark study published in Spine Journal followed 312 patients with disc-created sciatica who performed Mackenzie extensions. Snorts. After just 2 weeks, 67% experienced complete centralization of their pain, meaning the shooting light pain moved back up toward their spine or disappeared entirely. After snorts, 8 weeks, 74% were pain-free or nearly pain-free. Snorts. Even more impressive, an MRI follow-up study showed that 52% of patients had actual reduction in disc bulge size after 12 weeks of Mackenzie exercises. The snort's disc physically changed and moved away from the nerve. Those numbers put this exercise in a league of its own. Clears throat. No medication can claim those results. No injection can claim those results. This is pure mechanical therapy using your body's own healing mechanisms, and it works best for people over 60 because age-related disc changes actually respond better to directional preference exercises. To perform the Mackenzie extension properly, start by lying face down on a firm, comfortable surface. Place your hands palm down on the surface next to your shoulders, like you're about to do a push-up. Your legs should be straight behind you with your toes pointed. Now, here's the critical part that determines success or failure. Before you start pressing up, take 3 deep breaths and consciously relax your buttock muscles and lower back muscles. Most people instinctively tighten these muscles to protect themselves, but that tension prevents the therapeutic effect from happening. You need those muscles soft and relaxed so the movement can affect the disc. Once you're relaxed, slowly press through your hands to lift your upper body off the ground while keeping your hips and pelvis in contact with the surface. Your lower back will arch backward into extension. Only lift as high as you can while keeping your hips down and your muscles relaxed. For some people starting out, this might only be a few inches. For others, you might be able to straighten your arms completely. Either is fine. The key is relaxation and proper position, not how high you go. Hold this extended position for 2 seconds while breathing naturally. Then slowly lower yourself back down to the starting position. Rest for 3 seconds and repeat. Perform 10 repetitions of this exercise and complete the series 4 to 6 times throughout the day. Yes, this is more frequent than the other exercises, and there's a specific reason why. The snort's disc material that's pressing on your nerve has a thick gel-like consistency that wants to stay where it is. Frequent repeated extensions throughout the day keep pushing that material back towards center and prevent it from migrating back toward the nerve. Think of it like trying to move toothpaste back into the tube. One squeeze won't do it, but repeated gentle pressure in the right direction eventually gets the job done. The timing of your Mackenzie extensions makes a huge difference in results. Snorts. Perform your first session within 30 minutes of waking up because your discs absorb fluid overnight and are more responsive to directional movement in the morning. Snorts. Do another session after you've been sitting for more than 30 minutes, whether that's eating breakfast, working, or watching television. Sitting increases disc pressure by 40% compared to standing, so breaking up sitting time with extensions counteracts that pressure. Do a session after any activity that aggravates your symptoms. Progression with this exercise is gradual but powerful. Start with partial extensions for the first week, even if you feel like you could go higher. Let your tissues adapt to the movement. In week 2, you can begin pressing up higher as long as you maintain hip contact and muscle relaxation. By week 3 or 4, most people can perform full cobra extensions with straight arms. Some people eventually progress to doing the extensions while standing, which involves placing your hands on your lower back and gently arching backward. The research on progression is clear and compelling. A study in the Journal of Physical Therapy Science tracked patients who performed Mackenzie extensions with proper progression protocols versus those who jumped in too aggressively. The gradual progression group had an 89% success rate with minimal pain flare-ups during treatment. The aggressive group only achieved 53% success, and 42% experienced temporary pain, increases that made them want to quit. Watch for the centralization phenomenon because it's your sign that the exercise is working exactly as intended. Centralization means your pain moves from your leg back up toward your spine or lower back. Many people panic when this happens because they think the exercise is making things worse. Actually, the opposite is true. Pain moving from your leg to your back means the pressure is coming off the nerve root. Studies show that patients who experience centralization within the first 2 weeks have a 91% chance of complete recovery. One critical warning that could save you from making a terrible mistake. If the Mackenzie extension makes your leg pain worse or sends pain further down your leg, stop immediately. About 10 to 15% of people have a directional preference for flexion instead of extension, meaning they need to bend forward rather than backward. For these people, extension pushes the disc further onto the nerve and makes everything worse. If you're in this minority group, you need a different exercise protocol, and you should consult with a Mackenzie-trained physical therapist who can assess your specific directional preference. Combine snorts, the Mackenzie extension, with proper ergonomics throughout your day, and you'll maximize your results exponentially. Use a lumbar support roll in your car seat and office chair to maintain a slight arch in your lower back while sitting. This keeps the disc in a better position and reduces the pressure that builds up during prolonged sitting. Snorts. Avoid deep, soft couches that force you into a slouched position. When you bend down to pick something up, use a hip hinge movement instead of rounding your spine. The long-term data on Mackenzie extensions is equally impressive as the short-term results. A 5-year follow-up study published in the European Spine Journal tracked patients who successfully used Mackenzie therapy to resolve their sciatica. 83% remained pain-free or experienced only minor occasional symptoms 5 years later. Snorts. Compare that to surgical outcomes where 27% of patients experienced recurrent symptoms within 5 years. Many people ask whether they should continue the exercises after their pain resolves. The answer is absolutely yes, but you can reduce the frequency. Once you're pain-free, performing 10 Mackenzie extensions twice daily serves as maintenance therapy that prevents a recurrence. Think snorts of it, like brushing your teeth. You don't stop brushing just because your teeth are currently clean. If you've made it this far, you now understand something that took researchers decades to figure out, and that most doctors still don't emphasize enough. Your snorts sciatica isn't a life sentence, and you don't need expensive treatments or risky surgeries to get better. The 3 exercises we've covered today, the piriformis stretch, the nerve glide, and the Mackenzie extension, represent the cutting edge of what science knows about actually healing nerve pain rather than just managing it. Remember that 72% pain reduction we talked about at the beginning? That's not a pharmaceutical company's promise or a miracle cure claim. That's what snorts happens when you give your body the right mechanical input consistently over time. Start tomorrow morning with your first session. Set a timer. Do all 3 exercises in sequence and mark it in your calendar. Do the same thing tomorrow evening. Then repeat the day after that and the day after that. By the time you reach week 2, you'll likely notice small changes. Maybe you'll sleep a bit better or walk to the mailbox without wincing. By week 4, those small changes compound into real functional improvements. By week 8, you might find yourself doing activities you've given up on months or years ago. Snorts. That's not optimism. That's what the research shows happens when people commit to this protocol. Your body wants to heal. It's designed to heal. These exercises simply remove the obstacles and create the conditions where natural healing can occur. So grab a yoga mat, find a sturdy chair, and take back control of your sciatica starting right now. Which of these 3 exercises sounds most doable for your current situation? And what's your biggest concern or fear about starting them? Now, we want to hear from you. Do you or someone you know struggle with sciatica after 60? What snorts symptoms have been affecting your daily life the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching. All.